So we're going to get started. I'm Dr. Aleksandra Gajer, and today we are going to be talking about the peptide revolution. Peptides are kind of a buzzword these days. There are a lot of people talking about peptides, and I want to give you guys the most up-to-date information and give you the inside scoop on the best stacks that we've seen incredible results with for next level performance, which everybody wants. So, we have been on Earth as humans for about 300,000 years. And for most of that time, 299,000 years, we have lived until about age 45. So we're living with these ancient genes that had us health optimized until we're about 45. And because that was our life expectancy. And for thousands and thousands and thousands of years, our bodies adapted to that. But now, because of antibiotics, vaccines, all sorts of other modern medical miracles, we are living much longer, and the prime of our lives comes a lot later. And peptides are naturally produced in our bodies, and they are chemical messengers, and they are down-regulated. We just don't produce as many of them after about age 40. And when we replace them, they can do some pretty incredible things. So we are seeing people really transform their body composition in as little as 12 weeks, recover from workouts in half the time, and feel like their athletic performance is where it was when they were much younger. We have brain peptides that are allowing people to think with complete clarity for hours and perform at a level that they haven't in many years, and really age in reverse at a cellular level. Peptides really are the forefront of cellular medicine. And I think it's really where medicine is going, of helping us optimize our bodies so we can not only live for a long time, but we can feel really great in all the decades that are ahead of us. And of course, have beautiful glowing skin. So all this is done without stimulants. All this is very sustainable if it's done correctly, and it's available now. It's no longer a future. Um, so most high performers, I work with a lot of high performers, and high performers can be anyone. I work with a lot of parents, a lot of people who are at the height of their career, a lot of athletes. And what I hear a lot is that people are running on a lot of caffeine. A lot of people are having poor sleep. There's a lot of chronic stress out there. Hormones are getting lower, and your brain just doesn't feel like it's working the way it used to. So a lot of people are operating at about 60% capacity, and most of us feel like that's normal because that's kind of what's accepted, is that you just kind of, maybe you feel crummy a lot of the time, but that's just what life is like, and that's how we have to feel. So again, peptides are your body's signaling system. So they are chemical messengers that send messages in your body to perform certain functions. And they can be used strategically to really optimize how your body works and how healthy you feel. They're not steroids, they're not hormones, they're not stimulants. They're basically a set of instruction that tells your body how to do something that it's already doing. And most peptides are something that's already being produced in your body. So the peptide revolution is here. There's been a huge amount of research over the last 10 years about peptides and how peptides can be used to really optimize human bodies. They've been used by athletes, bodybuilders for the last decade or several decades, but now we're really learning how to incorporate them into medicine and helping people really optimize how they feel. Most doctors don't know about them yet because it's certainly not taught in medical schools, but the people who are adopting this early and getting started are really an advantage. And I'm seeing people who are not only feeling healthier, but looking their best, performing at their best at any decade in life where they feel like those years might have been behind them, but they're really getting incredible results. So today we're going to talk about 5 performance categories and which peptides specifically can really make a huge difference in these categories. So we're going to talk about body composition, recovery and inflammation, cognitive enhancement, and longevity and vitality, and then more of the aesthetic stack, the glow stack. So we'll start with body composition. So peptides have really gained attention because of Ozempic. And everybody's heard of Ozempic. There's a lot of people who have taken GLP-1 agonists, and most GLP-1 agonists are peptides. They're polypeptides, so they're larger peptides. And in the medications, they are used at doses that make them act more like medications rather than peptides. But for body composition, we work with a few peptides and don't necessarily rely on GLP-1s extensively. I think GLP-1s are great and they have a lot of benefits, but I think they should be used at the lowest effective dose. And not everyone wants to stay on a medication for their entire life. And I think adding additional peptides um, to your regimen can sometimes make a huge difference, can make change happen faster, and can get people sustainable results. So if we want to work on body recomposition, anyone who wants to lose fat, build muscle, I think we all want to do that. And we now know that the most up-to-date research tells us that muscle is really the currency of health. And as much as we want to look good, we want to feel good, and muscle is extremely protective from chronic illness and is highly correlated with longevity. So the body recomposition stack, I think, is for anyone who wants to really optimize their body and keep performing at a high level. Athletes hitting plateaus, those of us who are too busy to spend hours at the gym, and anyone over 35, sometimes we go a little younger, but anyone over 35 really noticing body composition changes. And most people know that after about 35, the things that you used to do to keep yourself lean, to keep yourself strong, just don't always work. So we're seeing a lot of people who have stubborn fat, muscle loss, slowing metabolism, and just eat less, move more is just not working. So my favorite body composition stack, it combines tesamorelin, MOTS-c, and retatrutide. So tesamorelin is a growth hormone promoting peptide. There are multiple growth hormone promoting peptides. Tesamorelin, I think, is one of the more potent ones. We stop producing as much growth hormone as we get older. And tesamorelin is actually FDA approved. Most peptides are not FDA approved and are more investigational. And we'll talk a little bit more about safety later, but tesamorelin is one that is FDA approved for what's called visceral adiposity, which means too much fat around the belly. So tesamorelin is incredible at turning fat into muscle, improving body composition. It also helps with sleep because growth hormone is really important for sleep. I love pairing this with MOTS-c and a microdose of retatrutide. So MOTS-c is a really cool mitochondrial peptide that does a number of things. So mitochondria are the powerhouse of our cells. They're what create energy from the food that we eat. And MOTS-c really up levels how the mitochondria work. It's a short course, generally just a month, and people usually feel a lot more energetic. We see improvements in hair, skin, and nails, but also there's some fat loss with MOTS-c. It's what's called an exercise mimetic, which means that it sort of mimics the effects of exercise in your body. And for people who are athletic, it really gets you a lot more out of the exercise that you're doing. Um, and retatrutide is a GLP-1 agonist. It is a triple receptor agonist. So it is going to be FDA approved. It's not quite there yet. But it, in addition to working like the other GLP-1s and tuning up your metabolism and suppressing hunger, it also burns fat. It's also a fat burner. It does so very safely. So I prefer to really use a microdose of something like retatrutide in people who are just trying to optimize body composition. And generally, this works quickly, and people see real results in about 12 weeks. Um, This is somebody, I'll have a few patient examples. We've changed names in order to protect people's privacy, but this is somebody that we worked with, 45-year-old male who went from 28% to 18% body fat. We do in-body scans on everybody who comes to our practice. This gentleman gained 8 pounds of lean muscle in 12 weeks. He felt like his energy was just incredible. He said he hadn't felt like that in years, where the activities that he was doing, he was just getting a lot more joy out of the things that he was doing in his life. And training felt like fun, and his clothes fit like they did when he was 30, which is what all of us would like. Um, this is one more real life example. And this is Michael, who's one of the health coaches in our practice. Michael is 30 and he's on this on this Zoom right now. And he is a healthy guy. He's always had a lean body composition. And I want to point out here, his weight was stable over a long period of time. He did a bunch of body scans. His skeletal muscle mass was always nice and high. His percent body fat hovered around 18%. And then right here, where you see a real change, is when he started using peptides. He added peptides, he added this body composition stack, and he gained 13 pounds of muscle and his percent body fat went down from 18 to 12%. And this was in about 12 weeks. You know, he was already doing a lot of healthy things. He was eating well, he was working out, but the effect that that had on his body with the peptides on board was pretty dramatic. And he's been able to hold on to that. So next I want to talk about recovery and inflammation. This is another really exciting area. If some people may have heard the term aging, and we now understand that a lot of the aging process is actually due to inflammation in our body. And we're all experiencing inflammation. We live in an environment where we are exposed to chemicals, we're exposed to high levels of stress, and inflammation is sort of a part of life. And some people feel it more than others. I work with a number of patients who are dealing with pain that acts up on a regular basis, whether that's joint pain or back pain. Um, and as we age, sometimes the body just doesn't recover as quickly as we'd like it to get back to workout. So the recovery stack really helps reduce pain and just keep performance at its peak. I think it has really strong anti-aging potential as well, and is just a good foundation to heal the body at a cellular level. So what I like to use here is BPC 157. That stands for Body Protection Compound. And this is an anti-inflammatory peptide that specifically targets the gut as well as tendons, ligaments, muscles, and it accelerates recovery from injuries. It was initially identified in our stomachs. We make it in the stomach, but when we are able to get higher amounts of it, people feel like they can get back to workouts, they can do so much more in workouts, and inflammation and pain just doesn't act up as much as it did before. KPV is another anti-inflammatory peptide that's fantastic for gut health. A lot of people suffer from something called leaky gut. It's very common now just because of the chemical exposures that all of us are faced with. And people who have autoimmune conditions do particularly well with KPV. KPV is really great for trying to teach your system what to respond to and what to ignore. So a lot of our immune systems turn against us and can start attacking our own tissues. And this shows up as allergies, food sensitivities, sometimes autoimmune conditions. And TB500 or thymosin beta 4 works really nicely with both of these. And this is also more tissue healing and regeneration, and can really be a fantastic add-on in athletes. And all of these are done short term. We do about 12-week courses. And in people who have chronic inflammation, we sometimes return to these or continue with them. But I think they are a good set of peptides to do just some cleanup in the body to keep you performing at your best. So this is someone that we worked with who was a CrossFitter. She had a rotator cuff issue. She had pain that made her feel like she needed to quit CrossFit, which was a big hobby of hers, and her life revolved around CrossFit. She really loved her CrossFit community, didn't want to quit. She did physical therapy. She saw a surgeon who um, thought that she would most likely need surgery. She was really having trouble lifting anything overhead. We did this stack for 6 weeks, and her pain reduced by about 90%. She was back to competitive lifting. She went to back to the surgeon who said, I don't know what you've done, but keep doing that because um, it's working. And she was performing better than before the injury. And we've had a number of pretty remarkable results with this. So next is brain health. And brain health is I think this is kind of the least discussed part of peptide use. And many people feel brain fog, mental fatigue in the afternoon. And many people also feel like when they've reached the peak in their career, maybe they're not performing as well as they did in the past. And of course, we're relying on a lot of caffeine and um, a lot of people are finding that they are dealing with brain fog, declining focus. So the brain peptides can help us perform better, but also they're really protective against dementia and Alzheimer's and declining brain health. So the two that I really like are Semax and Selenk. These were developed in Russia for their cosmonaut and military programs where the people they put this on needed to focus and perform in austere environments where stress was very high. So Selenk is a little different than Semax. Selenk reduces anxiety, but it also improves focus. So people who take Selenk report feeling calm but focused. Whereas Semax really improves focus, attention, learning, memory. It has less of that anxiety reduction component. So I've had people who've suffered all their life with ADD find that they don't need their Adderall as frequently, or maybe they don't need it at all. It increases something called brain-derived neurotropic factor, which is kind of our brain's fertilizer. It's what neurons need to feed on to work optimally. So this has been a real game changer for a lot of our patients, both Semax and Selenk. And we usually cycle these. We do 3 week cycles on. They work great together. And then we have people take a week off and sometimes do multiple rounds of both of these. Um, so James changed name, but this was somebody we worked with who was a CEO. He had really advanced in his career and he felt like he was hiding, that his cognitive edge was just not where it used to be. He got to this position and he would have periods of time where he felt really foggy and he had this whole imposter syndrome and felt like, I got to this place, but now my brain is kind of failing me. And we did Solank and Samax with him, and he felt like a totally different person where he didn't need as much coffee. He was confident in his decisions. He felt like he showed up more like himself, and he was really, he talked about feeling like his 25-year-old brain is back, which can be huge for our careers. So next, we have the longevity protocol. And I think this is really where we're going in medicine and what a lot of us want. We want to live a long time, but at the same time, our health span, the amount of time that we'll be healthy and alive is more important than our lifespan. And our longevity protocol really helps protect health and keep us living longer and happier as long as we can. And I think this is really for anyone. And of course, as we enter our 40s and beyond, most of the time we are a little more conscious of declining energy and declining vitality as we get a little older. So um, this is a really great stack, I think, for anybody just to combat aging, which, aging is inevitable, but we now understand some of the cellular processes underlying aging, and some of these can actually be reversed, and we can turn back our biological clocks at the cellular level. So I've included four peptides here. And sometimes we do all four, and sometimes we don't, but epitalin is a peptide that is really a master bioregulator. So telomeres are the end of our chromosomes. So every cell has DNA in it, which is wrapped up in chromosomes. And at the end of these chromosomes are telomeres, which are kind of the caps that protect it. And we know from a lot of research that once telomeres shorten, that kind of correlates with age. So epitalin, the research is still new on epitalin. We have some studies that have shown increases in lifespan of like 15% in animals, not yet in humans. But we do have human studies on this that definitely show decreased chronic illness and improved longevity. People who take it tend to live longer. It is just a 21-day course that you do once or twice a year, and it can regulate your circadian rhythm as well. It pairs really well with Pinelion, which is a brain longevity peptide, and it regulates the hormones that your pineal gland produces in your brain. It's neuroprotective, but also really regulates the circadian rhythm and the sleep-wake cycle. We've worked with a number of people who've had sleep issues their entire life, and after doing Pinelion for 21 days, are suddenly sleeping through the night and getting restful sleep, deep restful sleep. And some people do it for a little longer. We need to return to it or do little upkeep doses, but it has been really transformative for sleep. Um, NAD is also a buzzword. A lot of people have probably heard of NAD. NAD is a B vitamin, but it is a critical micronutrient for energy production in the cells. And it is also studied in longevity. And we know that declining levels of NAD correlate with aging. So a lot of places do NAD infusions, which we do as well. But we found that just doing adding NAD into our longevity stack works beautifully, and injecting it subcutaneously really helps improve people's energy and overall sense of well-being. And thymosin alpha 1 is an anti-inflammatory immune system optimizer. It's really good for protection from cancers. So our body is constantly seeking cancer cells and getting rid of them, finding them and getting rid of them. And thymosin alpha 1 seems to optimize that process and just balance inflammation and improve our overall vitality. So this is somebody who we did the longevity stack on, and she was a 52-year-old female. She's an executive, um, feeling a lot of fatigue every day around 3 p.m., just to crash. Her hair was thinning, especially at her temples. She noticed this a lot of white spots and seeing more skin there. She was using a lot of products on her skin, but she still felt like she was looking older, waking up 3 or 4 times a night. 8 weeks of this, and her energy just completely turned around. She saw a lot of hair growth. Um, a lot of people were commenting on her glowing skin, asking what she was doing. She was sleeping through the night consistently and just felt more vibrant and alive again. Um, so in Russian clinical trials, in a 12-year study in elderly patients, they showed 28% lower mortality and slower cardiovascular aging with epitalin specifically. It's sometimes called epithalamin. It kind of goes by both names. And then lastly, There's the glow stack, which is for anyone who wants to improve hair, skin, and nails. I think hair is very challenging. I work with bioidentical hormones. I work with a lot of women in perimenopause who we get their hormones balanced, but hair seems to be something that just continues to be an issue. Um, and radiant skin is something that everybody wants. So our skin loses elasticity, radiance. We get fine lines, and there's a lot of expensive treatments out there, and most men and women don't want to look older than they feel. So the glow stack includes GHKCU. That's the new peptide in this conversation about the glow stack. GHKCU is a copper peptide, and it stimulates collagen and elastin production. So those are the two factors that really keep your skin nice and tight. So it's a powerful wound healer too. It's also used in some anti-aging protocols. Um, and we've talked about BPC and TB 500 in the anti-inflammatory stack, and they work beautifully there, but they really also regenerate skin and hair, and people notice the skin and hair effects from those. So they work on multiple levels like a lot of the peptides do. So this was Jennifer. She did the glow stack at age 49, and she really saw a dramatic improvement in her skin texture. The products that she was using actually started to make a difference because her skin was responding to them. Hair regrew, and again, a lot of comments on how she was glowing. So I want to talk a little bit about how we use peptides. So most peptides are injectable, and they are what's called sub-Q injections, subcutaneous injections that go right under your skin. Peptides are not a substitute for a good lifestyle. They are generally an upgrade for people who are committed to taking care of their bodies. So I usually tell people that peptides help tune your body into the good habits that you already have. So um, they work beautifully in people who are already trying to prioritize sleep, nutrition, movement, stress. We usually start with about 1 to 3 peptides at a time, and these sort of protocols are examples. We personalize every peptide protocol to a person's need. We spend at least an hour and a half with you when we're first getting to know you. We get blood work, we do in-body scans, and try to make recommendations that are thoughtful and will move the needle the most for you when it comes to your goals. And um, we cycle most peptides, which means that we don't stay on them forever, but we put complementary peptides together so you get the most bang for your buck during every stage. Safety is really important when it comes to peptides. Peptides have sort of come on the market and they're highly unregulated, and there are unsafe peptides out there that it takes a lot of effort for a pharmacy or a lab to create peptides that are sterile, that don't have any toxins in them, and that have are pure and have the purity that we require. We work with an FDA registered lab that makes pharmaceutical grade peptides with highest quality ingredients, and we send all our peptides for independent testing for all three of those factors for endotoxicity, purity, and sterility. So um, there are peptides, unfortunately, that if you don't make them very carefully, if the lab or pharmacy doesn't follow all the steps, there's something called lipopolysaccharides that are very inflammatory that when they're injected into the body can actually stick around forever and cause major damage. So understanding where your peptides are coming from is really important. Working with a knowledgeable physician, making sure that you're using pharmaceutical grade sources only. I always tell people don't inject something you randomly got off the internet. It seems like common sense, but it's important. And regular check-ins are important to with somebody who understands the physiology of your body and your goals. Um, so the investment. I'm not going to go into pricing for particular stacks or the exact pricing, but all in for a month, you can spend anywhere between $300 and $800, depending what stacks you're doing. And that includes all your peptides and your visits and your scans and your labs. So um, while it can be an investment, we found that it's an incredible investment in people's health. Um, and many people have avoided surgery and have basically maintained their performance and their productive years far longer by investing in peptides early. So who is a good candidate? People who are performing highly in their lives and they want a competitive edge. Um, Most of the time, 35 plus, and noticing some kind of decline in your performance. Wonderful for athletes, wonderful for those of us who need our cognitive performance to be um, at the top of our game. Um, and, you know, a lot of people feel fine, good enough, and everyone feels tired, but you really want to feel great and you want to feel extraordinary. So this isn't for, again, not a quick fix. If you're not ready to work on sleep, nutrition, movement, and trying to lead a healthy lifestyle, may not be worth the investment. So especially the body composition peptides, especially the growth hormone promoting peptides, if you're going to sit on the sofa and not work out, it may not be worth it. You want to do these things when you have the time and energy to make a push for a healthier body. Nothing extreme, but a commitment to your health. So I think this is really the new model of human performance. The old model was that aging and decline is inevitable. We hoped that we wouldn't end up in a wheelchair. I hope I never get dementia. I hope that I can walk upstairs when I'm 70. This is no longer something that we have to leave up to chance. And good enough is not all we can expect after the age of 40, and average performance is not normal. Um, uh, you know, I've worked with countless people that have reached their peak at ages that they were absolutely not expecting. And we have the science, we have the technology to upgrade the way our bodies are working at any age and really achieve extraordinary results. So, um, if you're ready to get started, anyone who's here can do a free consultation with us. Um, we will get you a personalized protocol. We'll do some labs, review your goals, and come up together with a personalized plan that fits your lifestyle, your budget, your timing, and each protocol lasts at least 4 to 6 weeks, and we check in with you regularly, see how you're doing, and figure out what's next. So, um, I will answer any questions that anyone has. I want to point out that anyone who schedules a consult today, on the day that they were here or listen to the recording, we're going to do an extra 20% off your first peptide order. I'm going to have someone drop the consultation link in the chat. And we're here to answer any questions. Michael and Patrick are here too. They are the directors at the Gajer practice. They're very, very knowledgeable about peptides, and they do a lot of the health coaching. They help me a lot with health coaching and counseling and hand holding while people are on their peptide journey. So any questions we can put in the chat, or if anyone has any questions, I'm happy to answer those. Okay, so where are we located? We are in Northern Virginia, but yes, we can do everything through telemedicine. So we're right outside of Washington, D.C. We have two locations in Vienna and in Burke. But we do offer all our services through telemedicine, so there's no need to be here on the ground. Um, and Shara Posner. said, is there any reason you don't add KPV to your glow? I think there are there's a lot of variations to glow, and I think KPV can be really helpful. Um, we really try to personalize it to the person that we're sitting across from and what other issues they may be dealing with. I think autoimmunity, it responds beautifully to KPV, and it can certainly be added. Side effects, that's a really good question. And I kind of glossed over this, but so peptides are short chains of amino acids, and most medications rely on your liver and your kidneys to break them down into metabolites that then have to be excreted from your body. And that's a lot of times where we see side effects. Most peptides are very safe and they don't have side effects like medications do. There are, again, I think it's really important to work with somebody who understands your health history. Um, People who have cancer have to be, or have had cancer, have to be particularly careful. We don't use growth hormone promoting peptides for someone who has active cancer because growth hormone can, of course, stimulate cancer. So there are contraindications. Some of the growth hormone promoting peptides also, some people have seen swelling with them, a little bit of fluid retention. Most people don't see that, but some people do. And sometimes there can be a skin reaction. Some people get what are called histamine reactions, where there's some redness around the area where you inject. And Mary said, how long do they last? When are they no longer effective? Or do you need to cycle on and regularly? That's a great question. Um, once you reconstitute a peptide, um, and I'm not sure if Mary's asking about how long the vial lasts, but they usually last about 45 days. But I think Mary's asking how long do the effects last? And I think that it really depends on the peptide. Like something like MOTS-c, the mitochondrial peptide, or epitalin or phenolion, we see effects lasting 6 months plus. With the growth hormone promoting peptides, we see changes in body composition, and most of the time, as people who are committed to their health are able to maintain the muscle that they gained. So the peptides can lose effectiveness if you stay on them consistently for a long period of time. There are some people who we do keep on some peptides for a longer period of time because maybe they have more inflammation, more health issues, but generally cycling them intelligently and using them 4 months is usually the max. Um, is all that we do, and it maintains their effectiveness the best. Are all the peptides you prescribe given by injection? Um, there are some oral peptides. In my experience, the injections work better than the oral peptides. Um, Mostly because, again, they are these short chains of amino acids. Amino acids is what protein is made out of. So when you eat chicken, that breaks down to amino acids. So a lot of peptides don't survive the trip through the GI tract. When you swallow something, your gut has to break it down, and then in your intestines, it has to go into the bloodstream, and then you see the effect. There are some peptides that I didn't talk about. BPC, there's another one called 5 amino Q that is also a mitochondrial peptide that do work well orally, and we can work with oral peptides. But a lot of them are injectable. Um, the injection is um, not bad though. They're tiny allergy needles. You can barely feel them. It's like a mosquito sting, and most people feel very comfortable. Usually, when we start with people, if you're not local, once you receive your peptides, we'll do a Zoom or a FaceTime with you and just walk you through every step of your first injection, and we can do that until you're comfortable self-injecting. And for people who are local, we'll help you out in the office. Great questions.
Yeah. I was going to add to that, Dr. Gajer, as well. There's also some topical
Yeah, there
creams,
are.
but those are more for the beauty than for like the growth hormones and things like that.
Yeah, GHKCU um is topical and which means that like it's like a cream and you can put it on your skin. There are some nasal ones too that you can kind of use as a nasal spray. Um, okay, so can you mix stacks? Yes, um, absolutely. So this, I gave these stacks as examples. Our practice is very personalized. So there's actually, oh, we rarely repeat exactly the same thing for more than one person. Each person has a different physiology. Each person has different goals. So if you have goals that belong to more than one stack, sometimes we'll combine them. And I usually try to stack peptides or combine peptides that hit as many of your goals as possible. And we can usually do that, do three at a time. I don't think it's useful to do more than three. I think cycling through them, doing three max at a time is usually the way to do this. And this is such a great question from Jason. Do you combine stacks in the same vial and needle or all done separately? And that is a great question. There are some, like KPB and BPC, I have people draw up into the same needle and they can be given together. So it's just one injection rather than two. And there are others that we prefer to separate. And some of that, we don't mix them in the same vial just because the concentration we found is not as reliable when they're all mixed together in one vial. It is easier, but we just tend to get better results when we know exactly the amount you're getting of each thing. Um, so some can be pulled into uh, the same syringe, others can't. And Shara asked, are you stacking with HRT? And that's another great question. And absolutely. So usually when I work with people with labs and lifestyle counseling, I want to make sure that your metabolic health and your hormone health is as tuned up as we can get it before adding peptides. I think peptides are somewhat the icing of the on the cake. Um, and that means something different for different people. For some people, we will check hormones, we will investigate your metabolic health and find that you're already balanced, you're good, and the peptides are a great choice. Some women are having perimenopause symptoms, but they're not ready yet for HRT. And then we use peptides to mitigate some of those symptoms. But absolutely. We stack peptides with testosterone, with bioidentical hormones where it's appropriate, and they work beautifully when they're done together. Um, Unfortunately, there really haven't been any peptides that um, can replace TRT. I wish that there was something that would raise testosterone consistently and reliably. We are looking into some new testosterone formulations now that are oral that don't require an injection that seems to be pretty reliable and don't have the liver issues that some of the older oral formulations have. So there are some options for sublingual testosterone. Um, there are options like HCG that stimulate a man's testicles to create more testosterone, as well as something like Clomid, which also increases a man's ability to produce more testosterone naturally. So we do have a lot of options when it comes to testosterone. I don't put everyone on testosterone, especially younger men. We think more about how can we get your body to produce more testosterone naturally before we fully replace it, but I don't have a peptide that does that yet. All right. Well, thank you so much, everyone. Thank you for your attention and for your great questions.